Hi, let's talk about mental and physical burnout today. And I am in conversation with one of the best mental health practitioners that I know in the world, Dr. Nitin Shukla. Dr.
Thanks.
Nitin is a consultant, acute medical lead psychiatrist at Orygen Youth Health based out of Australia. He's director and master trainer at Person First Private Limited, uh, conducting RANZCP and RC Psych accredited psychotherapy trainings. And probably Dr. Nitin would be able to explain better what they are. And he's also a director at California Hypnosis Institute, USA. And I'm honored to have you, Dr. Nitin, because nobody understands mental health better than you do. According to me, and in a while, even our guests would know that. I wanted to talk about burnout today, and that's spreading at workplace like a pandemic. Probably we are hearing so many newspaper clippings and news around about people even losing their lives because of burnout. McKenzie defines burnout as the feeling of depletion, cynicism, and emotional distance that results from a lack of impact or autonomy at work. Many people are really confused about how it feels, right? I get many queries from people who tell me they're not sure whether what they're experiencing is burnout or not. People working really hard, getting exhausted and tired. Would that qualify as burnout, or are there any specific criteria to label a condition as burnout? What do you think?
Well, thanks for asking the questions. First of all, thanks for raising this issue because burnout is something which is interestingly the first step is to begin to talk about it and recognize it.
Mm,
Um, I when I interact with people in the corporate world, I will ask them about how many of them would raise their hands and say that they are not stressed. So I would hardly get anybody raising their hands, probably the boss, just to show that this is a stress-free organization. Um,
mm.
but that shows the state of affairs.
Correct.
And I'll take it a step back. You are a psychologist, I'm a psychiatrist. We were trained in how to assist other people.
Mm,
But even we, despite being in mental health, did we get even a single lecture of or a single discussion about how to manage ourselves, how to keep ourselves okay at work? So, what I'm trying to highlight here is that burnout is something which is not an insurmountable problem, despite almost everybody experiencing it. If we begin to talk about it, recognize it, then we can start to take steps to work with it. So,
correct.
what you asked about is any exhaustion a burnout? Is
Mm,
feeling tired or feeling stressed at work a burnout? One of the challenges in mental health, as you already know, is we don't have the luxury of, I'll take your blood test and give you a diagnosis of burnout or depression or anxiety. So there are certain criteria which have been used to differentiate normal stress or difficulties at workplace compared and how is it different from burnout. And I think the most standardized manuals we use are the DSM and the ICD, which is International Classification of Disease. Both of them recognize these three elements. One of them
mm,
is it's chronically going on. So it's not
mm,
that you are my boss, I joined the company first day, and on that day I claim I burnt out.
mm, mm,
It's going on for quite some time, but it's just unsurmountable. It's not being managed.
mm.
That's the nature of the background. And then what I begin to experience is mental and physical exhaustion.
Mm.
And it's not just one day. I find myself being more and more exhausted at work. So
Okay.
that's one important component.
Okay.
It's a physical manifestation
Correct.
because some people are not very good with emotional language. It's important to recognize that. The second
Mm,
would be there is a sense of loss of motivation, interest, engagement with work. I'm not looking forward to going to work.
mm,
And then there is a very negative attitude which builds up that this is not a good workplace, this is not good work. So I start to have a very negative attitude towards work. So physically, I'm exhausted. Mentally, I'm not interested. And towards the work, I'm starting to feel a sense of detachment, non-engagement. So the
Oh,
combination
hmm.
is, if I'm experiencing all these, then it's very clear that I have
I
a
have
burnout.
a bunch. Sure. So, Dr. Nitin, that's insightful, but tell me that you're based out of Australia. I'm in India, keep traveling to the UK. Would burnout feel the same everywhere in the world, or are there cultural contexts to burnout as well?
There are cultural contexts to burnout, which are, for example, if I go into the workplace with an expectation that this is going to be in my, for example, if you compare Japan
Hmm,
and then you look at India and then you look at Australia and then you look at some of the European countries,
hmm,
it would be different in terms of the prevalence and
hmm.
how many people are experiencing it.
Correct.
That varies because, as we know, um, even all stress related research in psychology uh, acknowledges one important fact that those people who didn't know this was stress was somehow not
Hmm.
feeling so stressed about it.
Yeah, so that's what I was asking. Was in India, people are prone to working really hard even after working hours. And
Yes.
some of them might not be feeling burnt out yet. In the UK or in the US or in the Australia, people have a clear segregation that no work after 5 o'clock, and if they are told to extend after 5, even if they're working till 6, they may start experiencing that exhaustion because
Yes.
that's how their mind is accustomed. So is does burnout have that cultural connotation to that as well, or is it everybody will experience
Yes.
burnout because you're overworked?
See, um, workplace culture is significantly influenced by the culture that you're in.
Correct.
However, when we experience it,
Hmm.
it is as significant.
Correct.
And what I mean by that is it's always helpful to look at certain paradigms of thinking. If you look at sort of Maslow's hierarchy,
Hmm.
the developed countries, the lower parts of the pyramid, their basic needs are satisfied. So you are
Hmm.
spending more mental and emotional energy. You're
Hmm.
much more aware about things. And I think that also plays a role. While
Hmm.
if I'm in a culture and society where I have struggled to move to through these lower basic needs, somewhere in me, both positively, I develop more resilience,
Hmm.
and
Hmm.
negatively, I do not acknowledge that even when it exists. People can see that I am burning out. People can see that work is affecting me negatively, but I refuse to acknowledge it.
Very important point because a lot of people might be experiencing burnout, but because they have to feed their families and that's the only way that life will go on for them, they probably don't even notice it because they're so busy and probably trapped in whatever they're doing. And it's important to recognize what your body and your mind is trying to tell you. Otherwise, the candle will burn out and at the end, it won't give light anymore. So,
Absolutely.
what other mental health conditions could burnout lead to, Dr. Nitin? Because you're an expert in mental health, you would probably also know deeply about what anxiety is, what PTSD is, post-traumatic stress, or other psychological issues that people may encounter because it started with burnout and then led to something bigger. Does that happen, or is it?
It definitely happens. And I always encourage people to reflect back on their own experiences,
Hmm.
starting with bullying.
Oh, yes.
So starting in schools, that concept of bullying, we know how it affects us. We know there are people who are bullies and then there are people who are bullied. We know the mental health consequences of that, how it affects education, how it affects satisfaction, engagement.
Correct.
And I think it's helpful to extend that line of research onto this also, that in
Hmm.
burnout, that's what's beginning to be the experience of people.
Hmm.
And this can therefore lead to significant anxiety related disorders. This can
Right.
lead to depression. And
Right.
in cultures where I am not either allowed to express emotions too much when it comes to
Hmm.
the professional space, then the body takes a toll. And then I'm
Hmm.
getting all sort of lifestyle diseases, including I'm increased overweight, I'm getting diabetes, I'm getting hypertension, increased cholesterol. All these, as we know, are related to common causes perceiving the workplace as threatening and stressful. So
Correct.
psychologically, lots of things, emotionally, lots of things. And I think one very, very important thing to recognize is how do we cope with it? And if I
Mhm.
start to cope with it with substances, if my alcohol becomes my friend, if my cigarette becomes my friend, if my cannabis becomes my friend in sort of that moment of need, that is becoming increasingly something which is unhealthy. But unfortunately, it is so accepted at the workplace that on a Friday, you might have your boss come and give you a 6 pack of beers.
Yeah. So you said that there are certain unhealthy coping mechanisms that people, unfortunately fall into when they are experiencing burnout. But then there must be some effective strategies also to manage it on the other hand. Could you please tell us something about that?
I think we can categorize it into what are the individual strategies, as in what can an individual do, what can I do for myself.
Mm,
Then there are interpersonal strategies, which are interpersonally, what can I do to
mm,
assist me? And
mm,
at the level of the institution, at the level of this organization, there are systemic
mm.
interventions that can be done. Um,
So
so,
some individual strategies that probably you could tell us about, and then we'll move to the organizational.
well, whatever is a healthy method that you cope with. For
Mm,
example, if 15 minutes of exercise before work or going to the gym after work is something which helps you burn out all that energy
mm,
uh, and is helping you to cope. Anything which is healthy and it is helping you to cope
mm,
individually is great.
mm,
Whether it is exercise, whether it is healthy eating,
mm,
whether it is sleeping. Too
mm,
stressed, sleep it off rather than try to drown it up with alcohol would
mm.
be more healthy for the body on a short and a long term.
Okay.
And interpersonally, very, very important to recognize we feel isolated and alone when we are
Mm,
facing burnout, and we keep thinking maybe I'm the only person experiencing this.
mm, mm, mm,
So, human beings as social animals are not designed to be alone.
mm,
Trying to hide it is probably appropriate for you for a person at the workplace, but you can
mm.
certainly talk to your friends, relatives, anybody where you can it can be a means of letting that out. It's like a vomiting. You had too much alcohol. Nobody likes to vomit, but better out than in.
Right. And you very rightly said that human beings are social animals, and then probably you're aware of that longevity study and happiness study that happened at Harvard. And it's one of the longest studies that, not just in psychology, but in any field that has happened anywhere in the world. It's 80 years, it started 80 years ago, and it's still happening. So they tried and measured happiness levels of various people and various parameters of what makes people happy and live longer. And they did it generation after generation since the past 80 years it's going on. And they tried every possible permutation and combination. The place where you live, does that make you happy? Or the profession that you have, does that make you happy? Or your financial status, whether you're rich or poor, does that make you happy? And they saw that in every parameter, there were rich people, there were happy people and not so happy people. So in a beach, people living near the beach, they were happy and some people not happy. People having a lot of wealth, some people were happy, some people were not happy. Nothing was making sense till the time they came across relationships. And that was the only thing until now, since the past 80 years, what they found out at Harvard Medical School is that if you have good relationships, that's the only parameter which is stable that gives you happiness.
And
So very,
that's
very,
very,
very rightly said.
and I think that's thank you for raising this because that is interestingly very quickly available to us once we get over our hesitation to there's a interesting quantification done that a person needs a particular number of hours per day of
Hmm.
social contact,
Oh
and the
wow,
number
I didn't
is
know that.
actually the number is 4 hours.
That's a very good strategy. I can implement it. You give me numbers, I can do it.
And thankfully, that 4 hours includes not just in-person contact, it includes interacting with human beings through your social media, texting friends, video calls, audio calls, everything is included as long as there is a live person on the other end and there is an interaction,
So this
not just a word.
conversation is adding to that 4 hours right now, me and you.
Absolutely.
Lovely.
Absolutely.
So 1 hour done in a day.
Yes.
Okay. So great. I mean, good insights. So, but coming back to burnout, burnout is a leading cause of anxiety and stress, like you said, and it's costing a lot of organizations a lot of revenue as well. And that's why it has become a big issue in organizations. According to the World Economic Forum, there are 12 billion working hours that are lost each year due to anxiety, stress, and burnout because of people taking leaves and attrition.
Yeah.
And according to another report by WHO, burnout is costing about $1 trillion annually worldwide. So, I mean, what's the message that probably you would want to give to organizational leaders so that they can help organizations save this money?
Well, let's begin from a very selfish level. For from a business perspective, what's the business plan for what's the business case for working on burnout?
Mm,
You have better productivity,
mm,
you have less attrition rates,
mm,
and uh, that phenomena of people literally checking out. So I don't resign from work because I need that money, but I don't
mm.
perform at work.
Right.
So all those factors significantly change. So it's very simple to compare. Imagine myself
Mm,
exhausted,
mm,
disengaged from work, and looking at work that this is my enemy, and I and my productivity is already going down.
mm,
Then
mm,
look at me coming in motivated, enjoying meeting people at the workplace,
mm,
getting good mentoring from my boss,
mm,
and feeling like, okay, I need to contribute to this company.
mm, mm.
Which employee would you choose?
Of course, the
So you
second
have a
one.
choice.
Yeah, yeah.
So
Of course, the
organizations have a choice to um, choose from a very simple, selfish perspective. I will have better employees, better output if I invest in working on burnout, recognizing and changing that. And the other part is if you take it at a humane level, then you are there in your organization and its organization is made of people.
mm,
Those people, in a way, that's your gratitude and thanks to them that you have this company running so well or so bad. So you
mm,
need to be able to extend it from a very selfish level to a very selfless level.
mm,
And that's when you will be able to look at it in a comprehensive way. Because people usually have found they start to fluctuate and jump between, yes, I want to assist people, get better outcome from people, but I don't even want to treat them as human beings.
mm.
So this will not align. To align it, at least at a thinking level, one has to start to stretch their thinking, and then there is more engagement from the organization. And this sort of thinking change I'm talking about at senior levels.
So then what that thinking probably, if we give a word to this thinking, is becoming more intentional and more aware
Yeah.
about what burnout is and then, doing something about it. But what is that something that people can do about it?
So if you're asking at a systemic level,
Leadership
uh,
level, organizational level.
yes, I think just like again comparing it to bullying,
Hmm,
if there's a particular person who's known to be bullying several people in the school and in the class,
hmm.
working with those 20 people versus working with that bully, which is more efficient for the school?
I think working with the 20 people so that they can be empowered to counter the bully.
Yes.
What do you think?
Yeah, yeah. So that's an important element. But the reality is that both need to be addressed.
That's true. I mean, if there was a choice, then I would have, but yes, of course.
Yes. So while we're looking at burnout, only looking at sort of the targets of burnout, which is employees,
Hmm,
many times significant contribution comes from a few people who are
hmm.
displaying behavior. They are
Correct.
very critical or they are very manipulative, or they are very difficult to interact with,
Correct.
recognizing those people and supporting them to change is quicker and more efficient for the organization, while at a larger level, it is working with everybody to enhance their um, their strengths, to be able to highlight that, speak up for themselves, report it
Correct.
higher up, things like that.
Correct. That's very similar to what's coming to my mind is the organizational DEI journeys that we do, where you equip the leadership into more inclusive leadership and more inclusive practices. However, and at the same time, you equip the women of the organization to be more empowered and powerful and, own their space. But if you just do women empowerment workshops and they come back to the same organization where there were loopholes for their progression, then no matter how much I empower them, the organization and the culture will still bog them down. So it needs to be done simultaneously.
Because it's a relationship. It's a
Correct.
relationship between organization and the person, but it's not directly the organization. People in the organization
Correct.
with people in the who are being affected. So if it's a relationship, it takes two to tango. Both
Yeah,
working with both of them and supporting them.
correct. Beautifully said. So, for our guests, I also probably want to tell them who are watching this video that Dr. Nitin is a master hypnotist, and he can hypnotize you. And he, like I said, is are you the CEO of the California Hypnosis Institute, or the director at the California
Would be
Hypnosis
a
Institute?
CEO is a pretty big word. I think people like you and me who are humble health professionals, we maximum want to call ourselves directors. That's what I'm.
And so, I mean, he leads and works in this field day and night and trains people across the world in hypnosis. So he might hypnotize you. So tell me, are there any such strategies that people can actually, like hypnosis or NLP, that people can actually seek help in these strategies or in these therapies to overcome burnout?
Yes. Um, Before I suggest anything, if I'm really looking at neuro-linguistic programming, rather than suggest something new, I would ask you to look into your past.
Right.
And what are already your neurological pathways laid down for? Somebody says badminton is what works for me. Great. Somebody says I tried meditation, I went crazy. So I
Mm,
won't suggest meditation to that person. I will say whatever works for you. You have been there, done that. You have all the pathways inside already. All you
mm,
need to do is start to do it more and more. So most of the answers lie within yourself, because I'm assuming people who are watching us
mm,
are, if you have reached a stage where you're getting burnout, it also tells me that you are working at a pretty higher level.
mm, mm, mm,
And you have enough skills to have decades of resilience and go through different stages to reach where you are.
mm,
On this journey, there would have been thousands of skills which you have used. It's impossible that you had no skills of managing yourself when you reach there. So the simplest thing is look into your past. What has worked for you? Talking to friends works for you? Great. Start to make a
mm,
list of things that have worked for you. Walking works
mm.
for you? Great. Sleeping works for you? Great. Begin with what you can already do.
What works?
Yes. And
What works? Yeah.
exactly. And once you start to feel yourself enjoying those things,
Mm,
that's when you can open books, open Google, watch, and get new ideas about what more you can do. But don't stress about giving yourself anything new. Otherwise, resistance comes in. That I can't do it. Everything I need is there in the past. I look for it and I'll start to do it.
That brings me to the last question and what you just said that what works for you. I mean, that's quite a catchy thing that true knowledge is always within and listen to your body and your body will tell you or your mind will tell you what it needs. So absence of burnout or absence of anxiety is not happiness. Absence of burnout or absence of anxiety may just be numbness. So just trying to get rid of anxiety, like you probably go to a psychiatrist or a psychologist and tell them just I want to get rid of this anxiety. That's not enough, right? You need to work on the other side of the spectrum as well to get happiness. Because at the end of the day, the ultimate goal of life is feeling happier about yourself and the world around. Any tips that people can actually feel happy?
So, what I would encourage everybody to do is rather than look at these as positive and negative, for example, let's say you're my psychologist and I come to you and I say, I don't want anxiety.
Mm,
You'll probably ask me, what if I had no anxiety at any time, anywhere?
mm, mm,
On one hand, it feels so great.
mm,
But practically, if we look at it, if I really reflect, if I'm sitting in an examination hall doing, my question paper, I think 5 out of 10 anxiety will be helpful for me. Too
mm,
much will be an interference, but if I have no anxiety, I don't think I'll be able to finish on time.
mm,
If I'm at my workplace, I'm seeing a patient, I want a little bit of anxiety to keep me performing at my best.
mm,
In my mind, 2 to 3 out of 10 anxiety is helpful for me when working.
mm,
So it's helpful to recognize that rather than try to eliminate anxiety or
mm,
fight against whatever I call negative,
mm,
look at what level works for me in which environment. So if
mm,
at work, let's say 3 out of 10 anxiety, let's say 8 out of 10 anxiety in the morning is great for me to get me work on time. Once
mm.
I'm at the workplace, 3 out of 10 anxiety is good enough to keep me on track.
Correct.
So let it be a sliding scale where I have a combination of anxiety, happiness, rather than no anxiety, only happiness.
Balance. Too much water is flood, very little water is drought.
Absolutely.
Thank you so much for your time, Dr. Nathan. I am honored, and I think great insights for the world, and the world really, really needs it. There is shortage of such experience and knowledge that people can share, and this is the